In today's video, we have a very special video for you. Dr. Lee from SkinFix is arranging a free surgery for one of his patients. Let's go ahead and get started. Our patient Delano is an 18-year-old male who had previously seen Dr. Lee about a year ago for a bump in his neck. That ended up being a giant lymphangioma. And Dr. Lee ended up doing a surgical procedure called a lymphadenectomy to remove that lymphangioma. The surgery went well. He was very happy with the outcome. Unfortunately, it looks like that lymphangioma has come back. And so he's back to see Dr. Lee, but not just any ordinary day. Today's a very special day because Dr. Lee has arranged for Delano to receive this surgery completely free of charge at a hospital in Beverly Hills. So we're going to go ahead and get into the operating room and see how this surgery goes. What's going on, everyone? You're watching this report? We are now live from the operating room. As you can see, this is an exciting day. We have a very special patient, Delano, who is going to get his lymphadenoma removed once again. But this time, Dr. Lee has hooked it up. He's hooked it up with a free surgery at a top hospital in Beverly Hills. All the costs will be covered by the hospital and Dr. Lee, so Delano won't have to worry about anything. As you can see, he does have a bump right here in his neck where that previous lymphangioma was removed. There is a small area where the skin is a little bit thinned out. Other than that, he looks great. So Dr. Lee, what is the plan for today? So basically, we're going to open up the area where we know there's a high likelihood that the lymphadenoma has returned. We'll do a thorough dissection, and if we find any lymphadenoma, we'll remove it. If we don't, then we'll do a thorough exploration and explain to the patient that we'll keep him on the list for another potential lymphadenoma removal down the road. All right, so Dr. Lee, this is the area where you previously removed the lipoma. Yeah, this area right here. Yeah, and so it looks like the lipoma has returned. Yes, it has. And so what's interesting about this particular lipoma is that it is quite cystic. Yeah, so when you feel it, it feels like there's multiple cysts in this area. Yeah, multiple. It's almost like a bunch of grapes. Yeah, that's exactly what it feels like. And so the treatment of choice for this particular type of lymphangioma is what's called a microsurgical lymphangioma. Microsurgical lymphangiomas are very interesting. They're very unique. Basically, I make very, very tiny incisions, and I use a microscope to identify the lymphatic vessels. I cauterize those lymphatic vessels shut and basically close them off. That stops the flow of lymph, and then the lymphangioma slowly, but surely gets reabsorbed by the body. All right, so it sounds like a pretty straightforward surgery. Yes, it is. Hopefully we'll be able to get all of it. We'll see. Sometimes you miss a spot or two. If we miss a spot, we'll just put him back on the list for another surgery. No problem. It's not a big deal. We just want to get as much of it out as possible. All right, Dr. Lee. Thank you so much for giving this young man a second chance at removing his lymphangioma. It's greatly appreciated. Yeah, no problem. Like I said, we just want to get as much of it out as possible. We want him to be happy with the result. All right, so I'm going to go ahead and get the surgery started. We'll check in with you later. Hello, everyone. We are back in the operating room with Dr. Lee. And Dr. Lee, we were just finishing up here in the OR. Yeah, it was a pretty straightforward surgery. It took a little longer than expected because there was a lot more lymphangioma than we initially thought, but we got it all out. Yeah, we did. So how is our patient doing right now? He's actually awake. He's talking. He's joking around. He's doing great. Awesome. Yeah, I think this went really, really well. Not only did we remove all the visible lymphadenoma, but I also did a thorough search for any additional lymphadenoma that may be surrounding the area, and I didn't find any. So hopefully this is a complete removal, and he shouldn't have any more issues with his lymphadenoma. Awesome. Well, thank you so much, Dr. Lee. We really appreciate you taking the time to do this surgery for Delano. Yeah, no problem. Like I said, just want to help him out. And that's gonna wrap it up for this video, guys. Thank you so much for watching. And as always, remember to stay safe out there.